With advancements in the healthcare space, continuous medical education or CME has become vital for not just maintaining but improving the quality of India's healthcare system. The Integrated Health and Wellbeing Council organized the inaugural edition of the CME Excellence Summit and Awards in New Delhi to emphasize the importance of CME for the medical fraternity. The initiative brought together policymakers, medical practitioners, pharma and medical organizations to discuss and deliberate upon the role of CME in ensuring streamlined supply of a quality healthcare workforce and to recognize the exceptional work done by medical practitioners. The summit began with a lamp lighting ceremony. Soon after, keynote addresses by distinguished speakers from various industry verticals, along with the Minister of State for Health and Family Welfare, Ashwini Kumar Chaubey, gracing the occasion as the chief guest, established the need of CME for quality healthcare delivery.
We are of the firm belief that skills and knowledge of our doctors are the most essential precondition for ensuring better health outcomes, and we all shall collectively work towards that. The CME Excellence Summit and Awards is a small initiative towards supporting that notion. We look forward to hear a lot of thought-provoking thoughts and insights during the day, and also to recognize the contribution of many stalwarts who have been contributing in the continuing medical education.
प्रधानमंत्री श्री नरेंद्र मोदी जी के नेतृत्व में हमने स्वास्थ्य नीति 2017 में बनाई। सर्वे सन्तु निरामया, सभी आरोग्य रहे। सर्वे भवन्तु सुखिना, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। सभी स्वस्थ रहें, सभी सुखी रहें और सभी भद्र हों और सभी एक दूसरे की पीड़ा को अपनी पीड़ा समझ करके पीड़ित मानवता के लिए वो आगे हाथ बढ़ाएं। यही हमारी सभ्यता है, यही हमारी संस्कृति है और यही हमारे मानवीय गुण है।
It has been continuous and critical need that the best of the medicines and medical solutions reach the common man at an affordable cost. For only when we are able to provide the last man with the option of quality and affordable healthcare and medicine can we create a Swasth Bharat. Fixing ceiling prices of 857 scheduled medicines, capping prices of medical devices such as coronary stents and knee implants, boosting government's Jan Aushadhi initiative for making quality medicines affordable to the poorest of the poor with almost 6,000 of Kendras in the country, bringing in transparency and accountability with the systems such as Pharma Jan Samadhan. This is online grievance redressal system. Have been some of the focus areas in the past few years.
The summit witnessed numerous discussions that brought together esteemed healthcare leaders to explore novel ideas to make CME training affordable and accessible. The first panel focused on how a robust CME system can help achieve the vision of Ayushman Bharat.
The latest data from the Ministry of Health and Family Welfare noted that so far 1,200 crore rupees has been spent under the Ayushman scheme. The momentum the scheme has gained in a short time since its launch is a witness to the country's enormous unmet need for curative care. However, the concern is that out of the total expenditure, 77% of the 1,200 crores which has been spent is on tertiary care. With the dual disease burden that we face in India today, and without a well-functioning primary care system, the scheme will not be sustainable nor affordable in the long run.
So the most important aspect is, I feel as far as in India is concerned, if we can concentrate on the primary care, you are going to reduce the burden on the secondary and the tertiary care. And this will go a long way because as we know, even as far as the government allocation funds is concerned, there is a limit to how much they can allocate the funds. So if you are going to save on the secondary and tertiary care, It will go a long way in bringing more families under this Ayushman Bharat scheme and help a lot of more people also.
As doctors, do we have a department of family medicine in our medical school? Do we have a curriculum of primary care in our undergraduate education? Do we have postings in primary care? Then how the primary care will be remembered? Therefore, this total science of primary care is totally buried. That is why government is also not keen to promote it. But ultimately, this has to be resurrected so that health of the nation will be there.
It is very, very essential if we can do continuous throughout the year online, ongoing CMEs of medical and paramedical staff working at comprehensive primary health care. Then it will definitely help in diagnosis, in time reference, in basic management of these all NCDs and other diseases. It will definitely not only provide quality care, but also decreases the burden to tertiary and second and tertiary care centers.
With the demand, with the demand shock coming in through Ayushman Bharat and with the limited supply that we have, I think, one thing which has become very evident is that we need to become more efficient in delivering the services with whatever existing resources we have. And, when we talk about resources, I think human resources are, the key backbone for actually increasing the efficiency. So, when we talk about the CME part, I think we are just not looking at, the CME for medical professionals, which are doctors, but we are also looking at upskilling our frontline health workers, which also includes your ASHA workers, which involves your paramedics, which involves your nurses.
The second panel, themed Indian CMEs versus International CMEs, looked into possible changes required in the Indian healthcare.
Whenever we see CMEs conducted in India versus the CMEs in abroad, we can see our CMEs are poorly attended, and the reason being the content of the CME as well as the way it is organized also is totally not up to the mark at all. So again, it's a vicious cycle, like the content is poor because not many are competent enough to speak in a CME, as well as the quality of the audience is also very poor. So unless we make it mandatory that everybody should be coming to the CME hall, and then only we will get a good quality discussion.
I think here comes the role of professional company like Omnicuris. When they approached Delhi Medical Council for their platform, the first question I asked, how do we know your content, your modules are authenticated? So they said that all the modules or the lectures are duly accredited by the respective academic bodies. So that is one of the way you can see the things are quality oriented.
India is one state. As against other countries, the well-developed country, they have one uniform policy. Why India, although it's a state subject, there should be uniformity, doctors going from one state to another. Why should have different hours to qualify for accreditation?
Another key panel highlighted the growing need and critical role of technology in CME in India.
Well, if we have to look back and ask ourselves, 20 years from now, we may all be saying, in the year 2019 on August 8th, people actually met face to face, because the era may change as much as everything happening on the cloud. I have been noticing how hard it is to let go of the habits and the behavior that we have developed over the years. It is, in keeping with the trends that we have to determine to let go. We cannot be clinging on to our old accustomed behavior, and it is very hard to change. As Mahatma Gandhi said, be the change you want to see.
We have done a fungal CME. We say fungal pe dangal. What it means is there is a dangal going on in fungus which is not getting treated fast. So we not wanted to share our knowledge, but we couldn't share. We could share to 50 people, 100 people. But
with online platform, we could reach 6,000, I repeat, 6,000 doctors, dermatologists all over out of 11,000. Our Omnicuris platform has been able to tell those people, look, this is the right way to treat this fungus, which would not have never achieved even if you had done a huge conference.
How do we ensure that more and more medical devices are produced in the country? Name it CT scan, or you name any kind of medical device. How do we do that? We are now formulating a policy so as to attract the best technologies that are available in the world, attracting them to come and invest in India. We say that any medical device industry that wants to establish itself in India, we give a lot of support, both in terms of common infrastructure, testing facilities, standardization, skilling support, and so on and so forth.
A special panel also deliberated upon the evolving role of hospitals and diagnostics industry in India with the context to CME.
Most of our students who go out and they are in practice like in his hospital or somewhere, their only complaint is, sir, time nahi milta. Because there is so much demand from the hospital, from patients, and there are no residents generally who teach you more than you learn from books. The best guys that I have who have paper with me in New England Journal, after 3 years, you realize their level with the current residents have gone down. This is just for the specialty, the brightest of the bright. 1 out of 100 may have an exception who will try to lit the lamp every day late night, but others will not. Unless the hospital has that attitude of accepting excellence, making these guys rewarded or incentivized for learning, there will be very little.
So substantially, I completely agree with Dr. Sareen's points. Attitudes are not only important how owners behave, but how the system behaves. Recently, this government has helped us by making DNB programs easily accessible. Until unless you have some academic input in the hospital, you won't have teaching. Individual doctors can learn themselves, teach themselves, attend CMEs and all that kind of stuff. But at the moment, hospital owners need to be encouraged, and they are being encouraged by this government to take more and more DNBs.
CME is not only for doctors, because your reflection is your own team. The doctor is there for 2 minutes with the patient, but the entire team, the nursing, the paramedical staff is actually the one which interacts. And if they are not educated, they are not taught the systems, I think that becomes a very, very integral part, and that is what Foxy is doing. We have a project called Manyata, which is quality improvement and quality assurance. Because the private sector is fragmented, there's difference in quality. We are talking about I'm not talking about the corporates. I'm talking about the small nursing homes also.
We are very happy and proud that CSI is being nominated for CME Excellence Award.
First, CME is very, very important because this medical education is changing every day. So we have to keep the track of it, what is going on in the global world. And second thing, how to reach to certain population, that's the way, the digitization.
At the summit, the CME Excellence Awards 2019 recognized medical practitioners who have achieved excellence and have created a positive impact in continuous medical education space. The ceremony started with a set of CME Excellence Awards. This set, the winner of the CME Champion in Nephrology for Organizations category went to Dr. Reddy's Laboratories. The CME Champions Award in Cardiology went to Dr. Keval C. Goswami, President, Cardiological Society of India. The CME Excellence Innovation Award for Institutes went to Dr. Hema Divakar, CEO and Chairman of Artist. The CME Excellence Innovation Award for Organizations went to Dr. Devashish Danda, the 2019 President of the Indian Rheumatology Association. The CME Educator Award for Organizations went to Dr. Nanditapal Shetkar, 2019 President of FOGSI. And the last category of the awards in this set was the CME Excellence Leadership Award for Associations, which was jointly awarded to Dr. Banshi Sabu and Dr. Deepak Jomani of RSSDI. The second set of awards were the Dronacharya Awards. The Dronacharya Award in the Oncology category was awarded to Dr. Ajay Gogia and Dr. Manoj Kumar Sharma and Dr. Meenu Walia and Dr. Prasad Narayanan and Dr. Vanshi Krishna. In the Sexual Medicine category, the Dronacharya Award was given to Dr. Shivam Priyadarshi and Dr. Mithun Bhartia and Dr. S.S. Vasan and Dr. Deepak Jomani. The Dronacharya Award in the Emergency Medicine and Critical Care category was given to Dr. Yatin Mehta and Dr. Kapil Zirpe and Dr. Pradeep Rangappa. The Dronacharya Award in the Pulmonology and Respiratory Medicine category was given to Dr. D.J. Christopher. The Dronacharya Award in the Diabetes and Endocrinology category was given to Dr. Banshi Sabu. In the Pediatrics category, the Dronacharya Award was given to Dr. Ashok Deorari and Dr. Bhaskar Shenoy. The Dronacharya Award in the Urology category was given to Dr. Anand Kumar. In the Nephrology category, the Dronacharya Award went to Dr. Jitendra Kumar and Professor Gokulnath and Dr. K. Sampath. The next category was Neurology, and the Dronacharya Award went to Dr. Manjari Tripathi and Dr. Satish V. Khadilkar. In the Hepatology category, the Dronacharya Award went to Dr. G. Chaudhary and Dr. Geeta Billa and Dr. K.T. Shenoy and Dr. Anil Arora. In the Orthopedic category, the award went to Dr. Gautam Chakravarti and Dr. Manoj Wadhwa and Dr. Swarnendu Samanta and Dr. Deepak Dave and Dr. Naresh Shetty. In the Cardiology category, the Dronacharya Award went to Dr. P.P. Mohanan and Dr. Ashwin B. Mehta and Dr. Keshav R. The final category of the award was Gastroenterology, and the award went to Dr. K. Vinay Chandran Nair and Dr. Saumil K. Shah and Dr. Dinesh Kini and Dr. E. Pedaviraju.
I will try to do the best for IAP and take it to a greater heights all over the country and maybe in the neighboring countries, being a South Asia Pediatric Association's secretary.
We are really pleased to receive CME Leadership Award at the Omnicuris Healthcare Summit. This award endorses our efforts in the area of improving diabetes care for poor people and poor patients of India.
And I feel very proud and privileged to receive this award of CME Excellence, which is called as a Voyager Award for CME Excellence, which is given to the Association of Physicians of India.